So today my talk is to manage urine incontinence in the elderly. So urinary incontinence, in short we call it UI, is a common and often under-discussed condition among the elderly population. So it refers to the uncontrolled leakage of urine, and this can actually significantly impact the individual quality of life, which is very important because that's why we are creating awareness and giving tips to those individuals that has been affected by this. And according to estimate, about approximately quite a high number amount, 25% to 45% of the elderly population is at some point of time experiencing some form of UI. And in terms of prevalence-wise, the condition is more prevalent in women, but then it also affects increasingly a significant number of men. So I will discuss the type of urinary incontinence and then the cause of it. So these are the common types that we encounter in our clinical practice. Some of you may be familiar with some of the types here. So first is quite a common one. It's called a stress incontinence. So it occurs when there is the bladder has increased pressure, and then when you cough or when you sneeze or you laugh, there is a urine leakage. So there's a stress on the bladder. So the common cause include a weakened pelvic floor muscle. So sometimes can be for women due to childbirth, hormonal changes, or obesity, or if you are always coughing, it can increase the pressure on the bladder. The second one is urge incontinence. So it's characterized by a strong and sudden urge to urinate, and then after that you suddenly feel like, suddenly you already leak urine. Yeah, so this one can be usually caused by overactive bladder muscle. So when the muscle is overactive, it contracts involuntarily. So even when the muscle is, when the bladder is not full. And the cause may include infection, neurological condition, and then certain medication that causes the bladder to irritate. And next, we have the overflow incontinence. So it occurs when the bladder does not empty completely and resulting in the frequent or constant dribbling of urine. And it's caused by obstruction in the urinary tract. So sometimes in men, it's an enlarged prostate or weak bladder muscle that fails to contract effectively. Next is functional incontinence. So for functional incontinence, it's referred to the inability to reach the toilet in time. So sometimes it may have been because of a physical limitation, or you are unable to walk. And so conditions such as arthritis, mobility impairment, dementia, or sometimes environmental barriers. And next, we have mixed incontinence. So this category is when an individual experiences a combination of urinary incontinence such as stress or urge occurring together. Then there's this type that is transient incontinence. It may be reversible, it may not be reversible depending on the factors. So things such as old age, aging, elderly, because there's a change in the bladder capacity and muscle tone, so it can contribute to urinary incontinence. And then, of course, certain factors such as medication and constipation and UTI can also trigger the incontinence symptoms. But the second category, mainly this type can be reversible if, let's say, you address the issue. So the symptoms will depend on the type of incontinence that you have. So if, let's say, you have so usually the common symptoms will include the inability to control urine, then when you sneeze, cough, there's urine leak, and then when there's a sudden urge to urinate, there's involuntary leakage, continuous dribbling after urination, and also frequently going to the toilet to urine. So how do we diagnose, or what are the evaluation tests that we can do? So first, of course, is to take a complete medical history, a detailed medical history. So this will include what is your symptoms and the frequency of you having this episode. And then surgical history such as whether you got undergo any operation before, chronic illnesses, your medication, And then lifestyle factors wise, then we will conduct a physical examination. So a physical examination will help us to identify any physical abnormality, so such as pelvic organ prolapse. And then, so what is commonly examination is abdominal, pelvic area, genital region, and also to assess the muscle tone, nerve function, and any signs of infection. A common test that we do is urine test. So it can be a simple urine analysis to rule out infection and any abnormality. And then in some cases, we may do a urine culture if, let's say, we suspect that you have bacterial infection. And avoiding diarrhea is important for us. So usually if you consult the doctor or the nurse and tell them that you have these incontinence symptoms, they will ask you to do voiding diarrhea, which is sometimes called as a bladder diarrhea. So this one, it involves you to document, it's like a chart. It involves you to document your fluid intake and then urinary frequency and episode of urine leak and over a specific period of time. So usually the first time you consult a doctor or the nurse, they will give you this homework to do. Then after that, maybe say, I'll see you 2 weeks later or 1 month later, then you need to bring this diary for them to look at it. So this is a very important information for us. So it provides us to see the trend of your urinary patterns and what actually trigger it. If, let's say, we are able to look at the pattern, it also aids in the diagnosis and the treatment planning. Other diagnostic procedure based on our physical examination or history taking can include urodynamic testing such as cystoscopy and then also imaging study. So in this aspect of managing UI, we often advocate a multidisciplinary approach. So that means like you may see a few people in a team. So this can be include specialists such as urologists, urogyne or geriatrician, and also collaboration with other healthcare professionals such as physiotherapists or psychologists. So in this aspect, the multidisciplinary approach will provide a complete holistic care for patients that is experiencing UI. So why are we talking so much about UI? Because it definitely has a very negative impact on the patient's quality of life. So firstly, it leads to physical discomfort. So individuals with UI may also experience skin irritation, rashes, infection because of the constant exposure to urine. And also it can lead to soreness in the genital area and reduce overall comfort. The most important aspect is actually the emotional and psychological aspect. So it can actually significantly affect an individual's self-esteem. So is frequently unreported because the patient feels like there's a sense of embarrassment, shame, and diminished self-confidence. They do not want to talk about it. They want to keep it like a secret. They feel ashamed to share with anybody else. And this fear of leakage can often lead to social withdrawal, and it affects their social activity, and it also affects the relationship that they have. And so a common psychological consequence of UI includes anxiety, depression, and a sense of isolation. And not only that, they also impact on their daily activities and independence because they are constantly worried about the leakage. And then because they need to frequently visit the toilet, so when they go out, they always need to eyeball where's the nearest toilet, in case they need to rush. So it can actually disrupt their daily routine and limit the participation in activity. And also the fear of public accident. So it can cause the individual to avoid leaving their home. And because they are so afraid that when they go out, they are unable to control the urine. And if they travel long distance, they are also afraid that they will have this frequent episode of urine leakage. Yeah. And then this one is also like a bit unreported, is the sleep disturbance. Because at night, if at night they keep waking up to go to the toilet, it will actually result in fatigue and further impacting their overall well-being. And for the elderly with mobility issue, this can have increased fall risk because they may need to rush to the toilet, and then especially at night when they sleep, and then when they suddenly wake up and feel the urge, right? Then they like get up very fast. They may not have the are fully awake yet, so when they go to the toilet, they may fall. So there is a risk of fall risk, increased fall risk. So that is due to the urgency to reach the toilet promptly. So potential accident. So what are the lifestyle modifications that we can do to address this issue? Actually, for UI, incorporating lifestyle modification is a fundamental aspect of managing. Yeah. So actually, by making simple or specific changes to the daily habit, individual can positively have control over the bladder. They do not need to feel so helpless, and also reduce the episode of urine leakage. So I'm going to suggest some things that we can do. So first is to have a healthy fluid intake. So we know that we know that people suffer from UI. Usually they try not to drink too much fluid. Yeah, but actually this is not advisable. So you need to maintain an adequate fluid so that you can support the overall health. But then you need to know that you cannot drink excessive, and also avoid those drinks that can irritate the bladder, so such as caffeine and alcohol. And then you need to know that you need to balance the fluid intake throughout the day, and not like at night. Suddenly you think that, oh, I have not drank enough fluid, like 7-8 glasses, then at night you start drinking. So this one will actually trigger again at night, you wake up to pass urine. And then, so when you balance your fluid intake, you can actually help to manage nighttime incontinence. Yeah. Then next, diet. Well, we also need to consider the diet. So certain food, beverages can irritate the bladder. So you need to be aware. So we need to, so based on your bladder diary, we will know how to identify. So some food that can trigger the symptoms, such as spicy food, citrus food, and then carbonated beverages, coffee, tea, those that contain caffeine and alcohol. We try to ask you to cut down, like not totally say don't eat, but cut down. And then a balanced diet and rich in fiber to prevent constipation that can worsen UI. So they are actually linked and related. So probably later Dr. Lim will address this issue of constipation also. In terms of weight management, obesity can cause the pressure on the bladder. So maintaining a healthy weight can help alleviate the symptoms. And then because, as I just said, extra weight can put pressure on the bladder and pelvic floor. So encouraging balanced diet, regular physical exercise, so be able to help manage the weight better. Regular physical exercise, so such as walking, swimming, to keep your body healthy, can help strengthen the pelvic floor also, and improve bladder control. So later our next speaker will teach you how to do some exercise to strengthen the pelvic floor. And then also encourage that you have, if let's say you need to see a specialized physiotherapist for them to prescribe the appropriate exercise and how you do it. Toilet habits and voiding technique. So establish a regular toileting schedule and avoid holding urine for excessive period is one of the very good toilet habits that we all should have. I know some people have a habit of going holding their urine. Yeah, so we advocate maintaining a constant interval between the bathroom visit. This is to train the bladder and improve control. So we do not advocate or advise patients to go to the toilet because they think that I better go. Later, I cannot go or I cannot find. So like just now before you come in, even though your bladder is not full, you just tell yourself, I think I go pass urine first, I go toilet first. Otherwise, later I then talk, then I suddenly feel like I want to go past urine. So most of us has this type of habit. Like before you go, you just say, I go toilet. But try not to do this very frequently. Try to train your bladder to wait till there is a certain capacity before you go. So proper voiding technique. So when you go to the toilet, take time, don't rush. Try to empty your bladder completely. This can reduce the likelihood of residual urine and associated leakage. So next, bowel is important, even though we are talking about urine, because regular bowel movement and preventing constipation is very essential. So when we consume a high fiber diet, you also need to stay adequately hydrated. And then establish a regular bowel habits. So because constipation can actually cause pressure on the bladder, and then this can lead to UI also. So if let's say you're suffering from UI, there is some assistive device and product that you can use. So some of it is displayed at the vendor outside. So absorbent pad, protective undergarment, and special bedding can also help to promote comfort. And if let's say you have a functional incontinence, you can use devices such as bedpan, urinal, and portable toilet. You can cut down the time that you need to reach to the toilet. And other treatment approach that can be prescribed to you is medication. So depending when you see the doctor, what is the underlying cause of the UI. So doctor may prescribe certain medication to manage your symptoms. So common medication includes anticholinergic, which help to relax the bladder muscle, or meropenem, which increase the bladder capacity. So these are the types of medication that are commonly prescribed. However, you need to also know that there's some side effect of the medication. So this need to be discussed with your doctor. And if all else fail, this is very rare, but sometimes it may happen. If let's say conservative management is not able to address the issue and the individual is severely affected by UI, in some cases we can go through surgical intervention. So it includes the procedure to support the bladder or urethra, correct structural issue, and addressing underlying pelvic organ prolapse. So these are some of the surgical procedure that we, if only the last resort. So in terms of psychological aspect, it's important to also be aware of what is happening to the individual who is suffering from UI. So we encourage individual to acknowledge and validate their feeling, to talk about it. Like, don't keep it inside, because when you talk about it, then you realize that actually you are not alone. Because if you don't talk about it, you always think that, I'm the only one suffering on this condition. But sometimes when you talk about it, you say, there are many people that also have the same condition as me. So this one is actually better for the mental health also. So usually the challenge is feeling of frustration, embarrassment, anxiety because of lack of control. So open communication is very essential to express concern. And then if need be, you can actually go through counseling and therapy, so such as cognitive behavioral therapy, to help the individual to address any psychological issue. So the therapist can also help to teach you tips on managing stress and how to live with this condition, and developing coping mechanism, so that you can feel supported. Then we also encourage self-care and stress management, because when you have this condition, you are very focused. You keep thinking about like, how do I manage this, or you are very self-absorbed. So we encourage you to also think of things that can keep your mind occupied. So self-care is important. So engaging in activities that you enjoy, such as hobbies, like social interaction, and then performing some relaxation technique. And in terms of stress management, deep breathing exercise, meditation also can help individuals cope with the emotional aspect of UI. And not forgetting the caregiver, because sometimes when the patient suffered from UI, there's actually a caregiver that provide cares, can be your loved one. So addressing the emotional well-being of caregiver is also important. So because we are often unaware that caregiver can also suffer from burnout, and because of the constant care that they need to give to the patient. So offer resource and support such as respite care and support group counseling services. Yeah, so in order to ensure that they receive the necessary support. And what are the preventive strategies that we can have? Like if you are not yet suffer from this condition, what can you do to prevent? So some of the strategy includes maintaining a healthy lifestyle, which is like quite overlapping with what I just said, but prevention is always better than cure. So we need to start from now to adopt a healthy lifestyle. So include regular exercise, balanced diet, and maintaining a healthy weight. So next is to stay hydrated. So remember, adequate hydration is essential, but then you need to have a balanced fluid intake throughout the day. However, we don't encourage excessive fluid intake, especially during the night. So pelvic floor exercise is another important aspect for bladder control. So later our next speaker will teach you how to do this exercise. And avoid irritants such as substance that can irritate the bladder. So and reduce the risk of UI. So drinks such as caffeine drinks, alcohol, all this to cut down. And then regular toilet habit. So promote healthy regular habit such as avoiding holding the urine for a prolonged period. And when you have the urge, just go to the toilet. So again, constipation, managing constipation. So if let's say currently you're suffering from constipation, then you need to really address this issue, because then it will, if it's unaddressed, it may lead to UI in the later stage. And avoid smoking, because smoking actually increases the risk of UI. And so if let's say you're currently smoking, try to stop, because it can also affect. So smoking can also affect the other area of our body, so it's very good if you can stop or not smoke at all. So I've come to the conclusion. So today the short talk is UI is a common condition among the elderly, and we have seen that it can actually significantly impact the individual quality of life. However, it's also essential to recognize that it should not be a source of embarrassment or shame, and that we can do lifestyle modification to control the symptoms or to manage the symptoms and increase and improve our bladder health. And open communication is important, awareness, so we can break the stigma associated with this condition, and then we can create an environment of empathy, understanding, and support, which is what we are trying to do today. So by having open communication and awareness, we hope that one day the elderly can have a fun conversation regarding their incontinence and not feel embarrassed about it. So with that, I thank you.